We talked a little bit about uh, kinesiology before we got started, and I know that you do some work kind of focused on that specifically. So can you share that with me a little bit?
Yeah, of course. So in kinesiology, like I said, we focus on using exercise and physical activity as approach for improving MS symptoms and disease management. So some of the work currently we're doing involving exercise training intervention for different population with MS. One project I'm conducting right now is using combined aerobic and resistance training for older adults with MS to improve their cognition and mobility. So in that program, we it's a home-based exercise intervention. Actually, we deliver those exercise equipment and materials for participants to perform these programs at home. So it's a 16-week program. We try to build that exercise habit through some social cognitive theory. So after the intervention is done, it's very likely these participants are going to continue exercise as habit to continue to improve their body function. So we found some positive results. There are improvement in their cognition, in particularly learning and memory, as well as their walking performance after 16 week. And then a lot of them continued exercise after the additional follow-up periods, which is additional 16-week follow-up. Yeah.
When you say you saw improvements in cognitive functioning, what were some of the things that were measured for this? Mm.
Yeah, that's a great question. We measure cognition using the standard cognitive battery. It's called Bicam's battery, which involves three tests. The first one would be SDMT, which focus on cognitive processing speed, which is how fast a person would react to the information around in the external environment. For CVLT and BVMTR, those are tests are focusing on learning, verbal learning memory and visual spatial learning memory. These three tests are very validated for MS. They're very strong cognitive assessment, specialized for people with MS. So those are important outcomes. A lot of interventions in DMTs they're focusing on to improve. Yeah.
Mm. What were some of the biggest challenges that you faced in getting people to implement this intervention?
Yeah, from that perspective, the big part is to have people motivated. That's the first part when they start exercise. Um, Oftentimes we found it's very hard to convince people for the first step. We ask people, "Do you know exercise is beneficial?" Yeah, of course, we all know that it's from the public health messaging, but would you consider start exercise? Would you consider continue your exercise? The answer kind of vary at that point. So the first part, when we start the program, we have some components to ask our participants or MS patients, why are you motivated to do your exercise? A lot of them are like, I want to engage more activities with my family. I want to travel. I want to follow. I just want to walk better, or simply. Once we know that these targeted outcomes they want to achieve their goals, I think we can more focusing on how are we going to improve specifically, especially when they have different outcomes they want to focus. Many of them, including like fatigue. I have a lot of fatigue where I know exercise will help. So how should I start? Um, Other things are like impaired walking. I realize there are worsening of my symptoms, especially my walking balance. I want to improve by that. So we have different guidelines and prescriptions for these individuals who are at different needs. So, for example, for people with walking disability, we want to focus on their aerobic walking. We prescribe them to exercise 3 times per week, including simply walking tasks from 10 minutes to 30 minutes across the program. And we also prescribe some muscle strength or resistance training that focusing on their lower extremity function so that to help them achieve better during their walking activities. Yeah.